In a minute. So, good evening, everyone.
Good evening.
Thank you. Welcome to Medical Mondays with Dr. O. Tonight, we have a very interesting topic. I hope you've seen it. Having an orchestra in the ears. Interesting topic. We'll be talking tonight about tinnitus. And we are blessed to have Dr. Lachelle Lazarus, who is an audiologist at University of Maryland Medical Center in Baltimore, Maryland. As a clinical audiologist, she specializes in tinnitus assessment and management, as well as vestibular diagnostics. She's also a preceptor to doctoral audiology in externs and interns in this setting. As a native of Toronto, Canada, Dr. Lazarus obtained a Bachelor of Science degree with a focus on psychology and biology from McMaster University in Hamilton, Ontario. She then obtained a doctoral audiology degree from Nova Southeastern University in Fort Lauderdale, Florida in 2016. A fourth-year clinical externship was completed at Yale University in New Haven, Connecticut. Dr. Lazarus worked as a clinical audiologist at Yale University, specializing in cochlear implants, tinnitus assessment and management, vestibular disorders, and comprehensive diagnostics. Within that position, Dr. Lazarus was the externship and internship coordinator. Dr. Lazarus is a current member at large on the board of directors for the American Academy of Audiology. With her well-rounded clinical experience, Dr. Lazarus is continually drawn to the various realms of audiology. Outside of direct patient care, she has a unique interest in supervising and mentoring students and new graduates in helping them navigate entry into their careers. Dr. Lazarus looks forward to continuing her development in her specialties while finding ways to provide opportunities for the newer audiologists to excel at their careers. We are blessed to have a woman with such strength and wealth to come and bless us tonight on Medical Mondays, and in conjunction with our very own attorney, Morenike Euba Oyenusi, who is a Nigerian-American author, publisher, lawyer, minister, and graduate of the University of London and Jesus College, Cambridge. She is a senior assistant county solicitor with Howard County's Office of Law. She also writes children's fiction, inspirational nonfiction, and poetry. Mrs. Oyenusi's publishing imprint, Paradise Restored Publishing, was set up in 2020 and has published her 3 award-winning books titled Chasing Butterflies in the Sunlight, Isaiah, and the Orchestra of Sounds, which is what she'll be talking about tonight, and The Shepherd's Care. In addition, Paradise Restored Publishing has published Dr. Patricia Aladekoba's Solace, Empowering Pastors' Wives to Prevent and Overcome Burnout. Ms. Oyenusi's favorite pastimes are reading, traveling, hanging out with her children and friends, going to the theater, watching movies, and going on very long walks. So, without much ado, I welcome our amazing august speakers, and I yield the floor. Welcome.
Thank you so much, Dr. O, for your very warm welcome and reception. And I want to take the opportunity to thank Dr. Lazarus once again for agreeing to appear on this program with me. I'm really excited to be here tonight. And Dr. Lazarus and I are going to be talking about tinnitus, and she will talk about what it is and what causes it and how you can prevent it and what the solutions are. And after that, we will go into part 2, where we'll talk about my own personal story and my journey of writing Isaiah and the Orchestra of Sounds. So just as an introduction, I'd like to play this video, which describes what the book is about and what my purpose was in writing it. It mentions an upcoming graphic novel. You can disregard that because it's already been published and it's out in the stores. I made this video when I was still trying to go to publication. So let me just play that as an introduction. It's just 2 minutes long.
Volume. We need the volume. Does it have volume or no?
Share audio.
1 second, let me see what I should do about that. Would that be my normal volume?
Share the audio together with the video.
It's at 100%. So I'll just continue and finish it.
No,
It's
but
at
you want to
100%.
share it.
Sorry?
You want to share it. It's 100% on your end.
It is 100% on my end.
Maybe she can forward the
Share
video.
the audio.
Sure.
Should I try it again or forward it?
I think forward the video to him. I think that might be easier because he has the system ready.
Yeah.
Okay, who do I
If you can forward it to Dr. Ajay.
1 second. Let me just see.
Dr. Ajay, can you share your email on the chat room if she doesn't have it?
I don't have it. What is the email?
He's going to share it in the chat room. There it is.
Okay.
victoryaj@gmail.com.
Okay, I'm about to do that.
Thanks,
now.
Dr. V.
Thank you.
We're a team.
Dr.
Thanks.
Ajay. So we'll have Dr. Lazarus start, or how long would it take?
I'm fine with her starting, but I'm forwarding it right now. Forwarded it already.
Okay.
Yeah, whatever you want to do is fine with me. I forwarded it.
Okay. Good morning, Haman, all the way from London. Welcome. So,
Dr. Lazarus, you want to go ahead?
Dr. Lazarus, you can start, and then, we'll play the video before Attorney Morenike.
Sure, I will share my screen here. Second. Slideshow. Okay, can you all see my screen?
Yes.
Yes.
Thank you all for having me. This is a blessing and an honor to be here. A beautiful big group, and I know some of you are just in the wee hours of the morning, and some of you are getting ready for dinner. So I appreciate everyone's attention here. I'm just going to take a few minutes of your time during this fruitful discussion and talk about tinnitus. So I say tinnitus, you may say tinnitus, perfectly fine. So what I'm going to do is just kind of give a good overview of what tinnitus is, what it isn't, and just kind of give some tips here. Thank you again for having me. So, as was mentioned by Dr. O, I work at University of Maryland Medical Center in Baltimore, and in September it'll be 5 years that I'm there. So happy to be there. So to give a background on, excuse me, on what is tinnitus. So tinnitus is the perception of sound in the ears or head when there's no external sound present. So for some individuals, they'll say, you know, I hear this ringing in my ears, I heard this noise in my ears, even when they're in complete silence. So this is what tinnitus is. It's very common. As you can see from this slide here, approximately 50 million Americans have tinnitus, and 2 million would describe their tinnitus as debilitating. So 2 million individuals would describe their tinnitus as having a negative effect on their life, giving them a negative quality of life. I'm not sure how many individuals on this call have tinnitus or have ever experienced tinnitus, but there are many descriptions for this sound. So if I was to ask individuals, I'll get a broad range of what it sounds like. For some, it's a high-pitched tone. For some, it's like crickets, it's buzzing, roaring, humming, hissing, running water. It can be musical. For some people, they say it's in one ear. Others say it's in both, or it could kind of feel like it's in your head. It can also vary in loudness. So tinnitus can take a wide range of descriptors when we're talking about how one describes their tinnitus. And the reason why we talk about tinnitus and we manage tinnitus is because it can be very annoying. And it can affect different areas of our life, such as our sleep. So a lot of people say they notice tinnitus or this ringing sound when they are sleeping, and that can cause us to feel irritable, exhausted, and or illogical. It can affect our concentration, so our ability to do our work and recreation. It can also affect our hearing. Now, that may be more of a hearing loss issue. So we would test your hearing to see how your status is there. But for some individuals, they say that because of the tinnitus, they're unable to communicate as well as they typically would. And then, of course, mood, right? There can be depression and anxiety that occurs due to this decreased quality of life from the tinnitus. There are many factors that can make the tinnitus bothersome. So stress is huge. When individuals are stressed, they can feel like the tinnitus is more bothersome. When you're exhausted, as I mentioned, when you're tired, you're a little bit more irritable. You can be bothered a little bit more easier. So when you notice this tinnitus sound and you're a bit tired, you didn't have a good sleep last night, then it could be a lot more bothersome. Noise exposure. So I'm sure a lot of you have, been in a noisy environment. And when you leave that environment, you may feel like your ears are kind of plugged and ringing. So that can affect the tinnitus. And what we want to do, right, is when we're thinking about preventing tinnitus, we want to make sure that we're using hearing protection in these noisy environments, and we're so used to these noisy environments as we just live and experience different events such as, weddings or even church events. It can get very loud. And although we want to immerse ourselves in the celebration, if we want to prevent the tinnitus and prevent any kind of hearing damage, then we want to be sure that we're using hearing protection. Certain medications can affect the tinnitus and how bothersome it is. Diet as well, different factors can be discussed there in regards to what can affect our tinnitus. And then, of course, monitoring, right? If we're constantly thinking, what does my tinnitus sound like? We are always thinking about it. We're bringing it to the forefront of our minds. We can make the tinnitus very bothersome. And then internet surfing. This is hard, but when we don't know why we have something, we typically go to the internet, to find the answers, to self-diagnose, but we can also find some misinformation on the internet. So we want to make sure that we restrict that. Why is there tinnitus? So the theories of tinnitus. So as you'll see on the slide here, there are three components to tinnitus. You have, or to the ear, sorry. You have your outer ear, your middle ear, and your inner ear. So for your outer ear, this is where sound enters the ear. And at the end of the outer ear, you have your eardrum, and this vibrates to the different pitches that we hear. And that vibration is sent to our cochlea, our inner ear. So these are where the hair cells that transfer sound information are to the brain. So why we could have tinnitus, there are some components here. It could be a conductive pathology. And what I mean by that is there can be something happening in this outer or middle ear, such as an ear infection, such as wax buildup in the ear, such as just fluid that's sitting behind this eardrum. And with a conductive pathology, if sound cannot conduct through to the inner ear, it can cause us to have some ringing. So what happens is when we're in quiet for long enough, our brain compensates for this and creates this ringing sound. So if you're walking around, let's say you had earplugs and you're walking around like this, what you're doing is you're limiting the amount of sound that's coming into your auditory system. And because of that, your brain will compensate and try to make this tinnitus sound. So if there's any conductive pathology or any dysfunction of the cell structures within the inner ear, so if you have a hearing loss, then you may have tinnitus. It's a compensation again. Think of it kind of like a phantom limb syndrome. I don't know if you've ever heard of if someone is amputated, they may feel sensation in a limb that's no longer there. So if you have a hearing loss, the brain is trying to compensate for the auditory information that it's missing out on. And in compensating for it, it's recreating that sound. So we have to kind of look at your case in as a whole to see which theory best lines up with your particular case. So how do we cope with tinnitus, right? So if you have tinnitus, what is the goal? Well, we know that with tinnitus, unfortunately, there is no cure. There's no like medication that you could take. There is no surgery, unfortunately, that you can do to just get rid of it. But we can cope with the tinnitus, and how we cope with it is through this term of habituation. So habituation is the goal when we're talking about tinnitus management. And what is habituation? It's to have a significant decrease in your negative reaction to a stimulus. So for example, think of your fridge, right? If someone were to ask you, what sound does your fridge make? A lot of you would say, I don't even know. I don't hear it. I don't listen for it. And that's because you've habituated to the fridge. The fridge still makes a sound, right? But because the sound has been labeled as unimportant, your brain learns to ignore it. So it's almost as if that sound does not happen. This is habituation. So we want to get our patients and individuals who struggle with tinnitus to a place where they've habituated to it, so that if they hear the tinnitus, they are no longer having that negative reaction. So it's not necessarily that the tinnitus will go away, but if there is such a neutral reaction to the tinnitus, then over time, we won't have that debilitating effect with the tinnitus. So does the brain play a role? Absolutely. The brain plays a significant role in how we habituate to the tinnitus. Context plays a major role in how we react to a sound. So think of it like this, right? If someone says your name, right? And someone says your name on your birthday, you're going to expect well wishes, you're going to expect celebration, you're going to expect blessings, you're going to expect everything that is positive, right? But let's say they call your name and you remember, ooh, I owe them $100 and I forgot. It's the same stimulus, but a different context, right? And because it's a different context, there's a different reaction. So we want to take the tinnitus and change the reaction that you have to it so that it is not such a negative, anxious reaction there. So in this bullet point, it says, it is because of our reaction that the tinnitus can seem louder than it actually is. If you mentally label the tinnitus as important, you will focus on it. If you label the tinnitus as unimportant, it will be easier for you to habituate to. So the brain really does play an active role. So now that we kind of know what tinnitus is, the theories behind it, and what the goal is, how do we reach that goal? How do we habituate to the tinnitus? Well, we have to retrain the brain, and we can retrain the brain because our brains are what we call plastic, which means that we can change those neural connections over time through information, positive thinking, sound therapy, stress management, and realistic expectations. And I'll kind of break these down here. So to retrain information, to retrain the brain, you have to gather information. So you're gathering information today, right? Although I'm kind of going through it speedily so that you have time to discuss, you're getting some background information on what this is. You also want to go to trusted websites. So not just every forum, right? Because you'll get misinformation, you can be misguided there. If you must search the internet, right? So ATA.org, Audiology.org, and NIH.gov. And you want to speak to your primary care physician, your ear, nose, and throat specialist, or someone like myself who is an audiologist. Positive thinking, right? We know that positive thinking works with so many areas of our lives. We need to adopt it when we have tinnitus as well. So it is critical that we change our outlook on the tinnitus. Although it is not a pleasant sound, we have to neutralize it with our thoughts, right? So we have to say, for example, I can learn to ignore the sound. I can learn to put it in the background. Consider placing these reminders where the tinnitus is most bothersome. So maybe it's right before you go to bed, right? Reminding yourself of that. When you wake up in the morning, reminding yourself of that you can learn to put this sound in the background. You can learn to ignore it. Sound therapy. So you may notice that the tinnitus is most bothersome in quiet environments. And that's because there's a big contrast between the loudness of the tinnitus and the quiet of the room. So we want to decrease that contrast by adding sound to our environment. So consider finding a tinnitus sound app to find the perfect sound for you. We don't want to trade an annoying sound for another annoying sound, right? We want to add in a sound that is calming, that you could do your daily activities with, and that's not so disturbing for you. So some examples of devices is, you can get an alarm clock with sounds embedded in it. You can get these headphones or headbands that have sounds embedded in it. Nowadays we talk about ear level devices that sit on the ear like hearing aids, and they provide sound to your auditory system. And then of course, other brands like Bose has devices as well that you can use to add sound to your environment so that you're not in complete silence. Stress management is huge, right? So as I mentioned before, tinnitus often flares up with stress. So stress management is essential. We all have our practices for stress management, whether that be, actual meditation, whether that be prayer, whether that be going for walks, whether that be, talking with friends that you haven't talked to in a while. understanding what is it that you do that allows you to reduce your stress and then make it essential. Taking, we're so busy these days, we go from one task to the other, to the other, to the other, but taking 5 to 10 minutes just to stop, meditate, regain that centering, and then move on with your day. And for realistic expectations, tinnitus, if it's debilitating, it can take 9 to 18 months on average for one to habituate to the tinnitus. But so be patient, but be diligent, right? We're working again on rewiring these neuronal networks. So we have to be diligent in the stress management, in the adding sound to our environment, and we have to do it consistently. And then consider cognitive behavioral therapy by a licensed therapist to further assist. So what a cognitive behavioral therapist will do is they will provide you with the tools of how to get through those low moments when you are dealing with the tinnitus, and give you those mental tools to cope in those very low times. So we find at our center that there's a beautiful co-relationship, I guess, between sound therapy, so adding sound to your environment, and also having a cognitive behavioral therapist to help you along the way. So there is support available. So for our center at University of Maryland Medical Center, we have a tinnitus and hyperacusis program. Hyperacusis is if you have decreased sound tolerance to sounds. So there is a 3-stage program. For stage 1, it's a group session where you would come in, and this is a very quick overview that I've given about tinnitus, but we go into tinnitus much more in depth. It's a 90-minute presentation that I would present. I or the other audiologist who specializes in tinnitus, we would present on what tinnitus is, what it isn't, dive a little bit more into the theories, dive much more into how do we cope with this. So that's the group session. And then for stage 2, we do individual testing and consultation with you one-on-one to see how the history of your tinnitus and how we want to move forward in a way that is individual to you. And then for stage 3, this is 1 year of sound therapy. So we follow up with you over the year, an unlimited amount of times, so that we could see how you're dealing with the tinnitus. Another source of support is cognitive behavioral therapy. So if you wanted to look up psychologytoday.com, you can find a therapist that is in your region, within your insurance coverage, and who is a cognitive behavioral therapist. And then, of course, we always want to make sure that we have these resources. If there's ever a crisis that you feel that you have, we'll always want to make sure that these resources are available. So I have flown through this, but this is our contact information. If you have any questions for myself, please feel free to take down my email, and I'd be happy to answer any questions. Anything you need a little bit more clarifying information, I would be more than happy to dive in to that with you. And then the office number, that's our general office number if you need any other answers. So I am at my time, and that was I don't think I've ever talked about tinnitus this quickly, but hopefully you have gathered some information about tinnitus. And again, thank you so much for having me. I'm happy to, I don't know if we have time for any questions now or later, but I'm happy to answer some now.
Yes, thank you so much. Oh, wow.
No problem. Should I stop sharing or?
Yes, please. You can
Okay.
stop sharing. But if you can also, when you have a little bit of a downtime now, if you can put your information in the chat box, because trust me, I'm sure some people will start texting to ask for it.
No
know-
problem. I'm putting in the chat now.
I don't think I've ever had a talk on tinnitus that was this succinct and so comprehensive, detailed, that I understand it even better. And I'm a physician. So thank you so much. I appreciate that.
You're welcome.
You said when somebody have tinnitus, and this is not a fun thing, we don't have treatment. That is true.
Mhm.
You said having sound around to kind of mute that ringing in the ears. And in case anybody has missed what this means, it's ringing in the ears. You know, it's like an orchestra playing in the ears. You said, you know, having sound in the background to down that ringing helps.
Yes, I want to clarify that a little bit. So adding sound to the background, you want to not necessarily cover up your tinnitus. And I know that would be the immediate relief. But if we really want to habituate, the brain has to have access to some of the sound to learn how to habituate to it. So when you're thinking about adding a sound to your environment, you want to put sound in your environment, but still hear, unfortunately, your tinnitus poking through it. Because what happens is if you've chosen a sound that is pleasant, that you're not really focused on, that you could do your daily activities with, if you have mixed your tinnitus well with that sound, over time, your brain learns that this should be something not to be focused on, not to worry about, and it learns to throw it to the back of its mind. If we're covering the tinnitus, our brain does not know what to habituate to. So the habituation process can be slowed down. It's good in the moment, right? But almost like that delayed gratification of using mixing rather than masking of the tinnitus, if that makes sense.
Yes, it does. Thank you so much for clarifying that. I appreciate that. I'm sure we have questions, but you're still going to be hanging around, right, please? Right?
I'll be hanging around, yes.
Thank you. Fantastic. So, Dr. Ajay, if you please play that clip for us. And then Attorney Morenike will then take over. Thank you. It still has no sound. There's an orchestra in the ear. There's still no sound.
Miss Euba, is it on your website anywhere that you could, maybe we could go straight to the link?
It's not. I would just suggest putting it to the end. It's very short. You can just look at the graphics and then I'll speak about it. It's not really that essential, but maybe just looking at the graphics would help. Thank you.
When no actual external sound.
He's speaking.
Yay.
Yes.
Hi, I'm Morenike Euba Oyenusi. I'm thrilled to introduce to you my second book, Isaiah and the Orchestra of Sounds. My book is about Isaiah, who's 14 and a half and living a perfect and peaceful life in Baltimore, Maryland, when suddenly he acquires an alien resident orchestra in his right ear. The lively story of Isaiah's battle with the unwelcome performers will keep you on the edge of your seat until the grand finale. Isaiah and the Orchestra of Sounds is a creatively illustrated graphic story from which you will learn more about tinnitus or tinnitus, a condition which affects over 50 million Americans and about 30% of the worldwide population. Tinnitus is the perception of sound when no actual external sound is present. These sounds can include ringing, tweeting, clicking, humming, buzzing, and chirping, and sound like sea waves, cicadas, trains, trucks, and even music. It may cause sound sensitivity, difficulty sleeping and concentrating, difficulty coping with work or school, fatigue, distress, irritability, anxiety, and depression. It affects children, teenagers, and adults alike. My goal in writing and seeking to fund the publication of this book is to make more people aware of tinnitus and particularly bring to the attention of children and youth their vulnerability to hearing loss and tinnitus from unsafe practices. The book contains valuable tips which may help tinnitus sufferers and help avoid hearing loss, the primary cause of tinnitus. I hope to get this important book into the hands of readers around the world with your generous help. Thank you for believing in my project and for your support. Everyone should have a copy of this book. It's unlike any book that you've seen in the market. It's essential reading for families, schools, pediatric offices, ear, nose and throat doctors, and the like. Please buy your copies and buy some for others. Thank you very much for your support.
So thank you so very much for your help in playing the video. Just wanted to show that as an introduction, and I wanted to really talk about my personal experience with tinnitus and what led to my writing of the book. Well, first of all, I'll talk about the book. It's about Isaiah, who's 14 and a half, and he lives in Baltimore. And all of a sudden, he acquires an orchestra in his ear, and this orchestra follows him everywhere he goes. And they're really annoying. They're very upsetting. And then the orchestra causes Isaiah to stop concentrating in school. He can't sleep. He's distressed. But his mother is a rock of support throughout the experience. And then, it really talks about what happens in the end. I won't tell you what happens in the end, but it tells you about his battle and whether or not he was able to overcome it. So in 2019, November, I suddenly developed symptoms. I was at church on November 24th, and after the service, we're about to leave service, and all of a sudden, I became very dizzy and very unsteady on my feet. It was actually very worrying. I imagined the worst. I thought, I was wondering, is this what a stroke feels like? It was just really horrible. And I just couldn't stay on my feet. And so I went into the pastor's office and he prayed for me. And then after about 30 minutes of sitting there, I was able to regain my ability to walk. And then my husband took me home. So that was on the Sunday. And then on Monday, November 25th, I remember that day very clearly because that was my daughter's birthday. It was, her birthday is the 25th of November. So, I had thank God that all those symptoms had gone away, the dizziness and all that. But then the following morning, I woke up and I was experiencing extreme nausea, as well as the same dizziness that I had the day before, as well as being unsteady on my feet. So I woke my husband up and I said, can you please take me to the emergency room? So he took me to the emergency room, and in that process, they checked my ears. They said, they didn't really see anything except maybe I had a little bit of fluid in my ear, and they said that it was they diagnosed vertigo, which I wasn't going around in circles or anything like that, but they said it was vertigo. But I later discovered it was an imbalance that I was experiencing, an imbalance caused by whatever was going on in my ears. So the next couple of days I was just really sick. I went to work, but I still could barely walk, and I was nauseous and also vomiting, and so I immediately booked an appointment with an ear, nose and throat doctor, which I want to highly recommend that if you have any issues with your hearing or your ears, you should definitely book an appointment immediately to see a hearing specialist, So I got there's normally a wait list, but I got seen by one in 2 weeks. And by then all the dizziness had gone away, but then I had started to experience ringing in my ear. And I call it ringing very loosely because of all the symptoms that Dr. Lazarus mentioned. I think I have most of them. All those different ringing, chirping, tweeting, all the things I referred to in my video, I have all those symptoms. The only symptom I don't have is music. I don't have music playing in my ear, but I have buzzing, I have truck sounds, I have train sounds and different things. So anyway, by then all that dizziness had gone, and I saw the ear, nose, and throat doctor, and he immediately ordered a hearing test. And when I did the hearing test, I discovered that I had partial hearing loss in my right ear. And I don't know how that came about. The doctor said maybe I had a possible infection that led to the hearing loss and led to the tinnitus, but I'd never had a hearing infection in my life. So that was, if it was a hearing infection, that was a first for me. But he said, basically what he said was that it was a sudden attack that had caused this, but he said, don't worry, I'm going to cure you. So I was very happy, very excited. So he gave me prednisone, and he gave me a couple of things to use, and he said, come back in 2 weeks. Well, I used everything and the sounds hadn't gone away. And 4.5 years later, they're still there. So I did see different specialists. I got second opinions, and eventually I ended up at the University of Maryland Medical Center's clinic, which is where I met Dr. Lazarus. And I did go through her 1-year program. I went through that 1-year program. But anyway, because of my experience, I really wanted to let everybody know what this terrifying condition was, because I had heard about tinnitus in the past. And I remember reading them, and I thought, God forbid that should ever happen to me. And at that time, all I thought it was ringing in the air. But I also read that once you had it, you would never get rid of it. So, and lo and behold, I began to have these symptoms, and it was just really scary for me. So initially, my way to deal with these symptoms was to write about it, so because I'm a writer and I write poetry. So I began to write a poem about how I felt. And I, continued writing that poem, and the poem became really, really long. And then I thought, okay, I've written a poem. What do I do with this? So I wrote a letter to a journal, an academic journal. I think it was probably Harvard or something. And I said, will you publish my poem? Well, I never heard anything back from them. And then God gave me the idea, why don't you turn it into a story that can be shared with other people, especially a story for young people, because the essence is to get young people aware of the things that can cause this condition, one of which is loud noise, exposure to loud noise. And we know how our young people are continuously exposing themselves to loud noise. So I wanted to get my story out. And God said, write a book and make it a graphic book. So that's what I did. I wrote the book, made it. I had an illustrator who did the graphics, and there it was. And then I included resources in the back. I included resources in the back to tell you what the condition was, tell you how you could prevent it, what kind of help you can seek, especially for children who might be undergoing maybe depression and they can't talk to their parents about it, or maybe they have difficulty concentrating in school, just like Isaiah did. I wanted to make people aware of the kind of resources that you can get, for example, from your teacher at school, being seated in front of the classroom, accommodation to help you to concentrate, because it is really bothersome and it can lead to difficulty concentrating. It can lead to depression. It can lead to different things, so you want to get the best help possible for your children. So that's why I wrote the book. I wanted to share the news about what this condition was and how you could prevent it. And in that process, I had the blessing and privilege of having Dr. Lazarus review my resources. So she did that. And she also, I'm really grateful for that, she wrote a foreword to the book, and because in the book I've used the musical theme, because I see tinnitus as being an orchestra of sounds, because it is, for me, multiple sounds. So it sounds like an orchestra, except that it's a very ghastly orchestra. that you don't really want to listen to, you know. So that's why I use the orchestra theme in my book. And also because I have a musical background, my father was a professor of music. I think that also sort of made me think, you know, I like to think about this as an orchestra. So the second person I had review the book was a doctor of music, of musicology, here in the United States. So he reviewed that, and he reviewed all my musical references. So at the end of the day, you know, I'm really pleased with the result. Now, the book was published in 2022, and at the time that I did the video, I was actually trying to raise funds for its publication, you know, because I did set up my own publishing entity, but, you know, with every publication, you need funds. So that's the reason I did make the video. But I'm really excited to be on this program tonight. And I really want to let people know as much as possible about the condition and how you can prevent it by protecting your ears. Dr. Lazarus mentioned going to church. When I go to church, I have earplugs in because the music is so loud that I don't want to make things worse for myself. You know, but even things like football games, you know, going to watch a football game, can become very loud. Things like listening to music. If you're listening to music and somebody is talking to you and you can't hear what they're saying, that means that your volume is too loud. You know, things like working with heavy machinery, for example, you should really have earplugs in. If you're a musician, for example, you know, because, you know, a lot of the time you're exposed to loud music, you want to wear earplugs to reduce the impact of the music. But even things like cotton buds that we put into our ears to clean our ears, that can be dangerous, you know. So those are the things that we should avoid. There are just so many things that we need to pay attention to. I just really want to spread the news amongst our community and amongst our children and even older people. I mean, let's put it this way: nobody is exempt from getting tinnitus. You know, it's all applies to all ages, and as the video says, it affects 30% of the world population, or over 500 million Americans. So that's a little bit of a background to why I wrote the book. Let me know if you have any questions.
Wow. Thank you so much for making yourself vulnerable to share with us so we can learn from you. We appreciate you. Thank you.
Thank you.
Wow. And thank you for those caveats. Please don't put Q-tip in your ears. Don't put anything in your ears. Dr. Lazarus, I know you'll echo this for me, that don't clean your ears with Q-tip. You don't need to do it. That's not what Q-tip is supposed to be used for.
Right. Agreed.
So I have a question here in the chat box from Dr. Veronica. And as you all know, you can raise your hands to ask questions or put it in the chat box. I'll be glad to read it. And Dr. Veronica says, thanks for the information. Is it a mental health issue?
So it is not a mental health issue. Mental health issues can exacerbate the tinnitus, but it is not a mental health issue. If you have anxiety, if you have depression, it can make the tinnitus seem more bothersome, more annoying. But tinnitus does not cause any mental issues. Tinnitus does not cause any hearing loss. If you have a hearing loss, you may notice the tinnitus. But what I'm trying to get at is tinnitus is not the cause of a lot of these physical or health ailments. These health ailments may cause us to be more bothered by the tinnitus because we're in more of a state of stress and worry and pain and things like that. So that's an excellent question, but no, it is not.
Thank you. Dr. Ajay says positive thinking is beneficial in every way. Thanks for sharing this very vital information. And Sister Melissa says, thank you. Amazing information. So thank yous, lots of thank yous and appreciation here. Sister Rochelle actually shares that she also has tinnitus and surviving. So this is great information. And Sister Umi Kamsin says, great information, Dr. Lazarus. Thank you. Question here. Zobam Ahanonu says, his patient or our patient was advised to get surgery for tinnitus correction. So this will not help, right? Because you did say that.
Yeah, that's an excellent question, and that is also a loaded question. I am not a medical physician, so when someone is being recommended to have surgery, there may be another cause as to why they're having surgery. I would be shocked if it was purely for the tinnitus. It's possible that this individual has significant hearing loss, and maybe it's surgery for a cochlear implant. Maybe there's surgery for some other, maybe like a eardrum pathology or something is going on there. So I can't say that that is incorrect because I don't know the person's individual case. So they would have to take that up with their medical physician. I would just be in not the responsible answer would just be that they have to talk to their medical physician about that.
Thank you. Auntie Tawa says, ask if tinnitus cause permanent hearing loss. I think you've answered that.
Yeah. So it does not cause permanent hearing loss. If you have permanent hearing loss, then you may notice the tinnitus because it's a compensation that the brain does regarding hearing loss.
Fantastic. And Haman is actually zooming in from London.
Oh, wow. Okay. Good morning.
It says, thanks for the presentation, most helpful. Something that he used to suffer from when he was younger, because I think he was exposed to loud sounds. He said he's retired from loud music sound systems and can understand the use of mixing
the tinnitus and not masking the tinnitus.
Exactly. So he's sharing his experience with us too. Thank you everyone for, being vulnerable to share that. So Dr. Alu asked, what is the safest way to clean your ears?
So the safest way to clean your ears is what I recommend is how far your pinky can go is what you can get. Earwax will naturally make its way out of your ear canal. So if you're taking a shower and use like a washcloth or a rag, you want to just, as far as that washcloth can go, that's how far you can go. If you're using a Q-tip, the reason why we advise against it is because you're actually pushing the earwax into the ear and you risk puncturing your eardrum. So we don't want that to happen, or you just pack that earwax in your ear without actually cleaning it. Earwax naturally wants to come out. So as far as your pinky nail can go, that's how far you should go. Other than that, you should see an ear, nose, and throat specialist to have it removed safely.
And there are over-the-counter drops.
Absolutely.
Like the Ruminex. I don't know if there are others, but I remember.
Yes. Yeah, Debrox. I'll put that in the chat too. So with Debrox, it's like a drop. And you want to put about 2 drops in. Just rest your head there for about 30 seconds. And then you're going to tilt your head back over it and just wiggle your ear a little bit, loosen it up so that you can get that earwax out. And I'll put the name of that in the chat. It's called Debrox there.
Fantastic. So how can you get the recording of this session? It's on Facebook and it's on YouTube. So if you search for Medical Mondays with Dr. O, it's right there on YouTube. Please subscribe. Hannah says, thank you for the information that she stopped using Q-tips and for the better. Fantastic. Thank you. Dr. Veronica says Q-tips cleaning when you have itchy ears. What do we do, please? Oh, I think she just answered that. Or is it how to use the Q-tips properly? What do you say to that? Is there a proper way to use Q-tips in your ears?
I would just say avoid it. I would say don't use Q-tips.
Oh.
Yes.
There's no proper way to use it. Please don't
Yes.
use Q-tips. Yeah. Hammond says, what advice would you give people who work in the hospitality industry, like nightclubs or bar staff who are in an environment of loud sounds and music?
Hearing protection. So getting earplugs, you can get custom earplugs made that are molded to your ear, and you should use those in those loud environments for sure. Those nightclubs can get louder than 100 decibels, and think of it this way: if someone has a hearing loss and is unable to hear 100 decibels, they have a profound hearing loss. So we're putting ourselves in these environments where it's significantly loud, significantly loud.
So the same thing goes with the next question about DJ. That can this condition be caused by exposure to loud noise, especially if you are a DJ?
Absolutely. Absolutely.
So, Dr. Oh, Sister Omi comes to say, oh, thank you as usual for facilitating this very important topic. She said she's not able to raise her hand. So asking question here. Please go ahead and unmute and ask your question.
Thank you, my Dr. O. Appreciate it.
You're welcome.
So thank you again, Dr. Lazarus. That was a great information that we shared. Dr. O will attest to it that I happened to be talking to her today. My son actually has this condition that just developed. He had a fall, and he mentioned that he has ringing in his ears. We were talking to Dr. O, and Dr. O said, oh my God, what a coincidence. We're going to have a topic about that. I cannot say the word. I'm still trying to practice saying it.
Tinnitus.
Tinnitus.
When people call it tinnitus, that's inflammation. This is not inflammation, so it's not the right pronunciation. It's tinnitus.
So it's tinnitus.
Yeah.
Tinnitus. Okay. So the question is, can you get it from a fall or a head injury?
You can.
Okay.
And yeah, a lot of people can get tinnitus when they're in a car accident, when they experience a fall, any trauma to
Okay.
the head, because our hearing organ is in our head. If there's any trauma to the bones there, because the hearing organ is housed in the bone, that's where the hair cells are. So if there's any trauma to the hair cells, then that's when this compensation may happen. It may not last for a very long time, and it may get better on its own, just with the healing process. But it is possible that from some kind of trauma that we get the tinnitus.
So when you say that, I just want to piggyback on what you just said. So because that came from a head injury or trauma, you might be able to get rid of it faster, or it doesn't. It depends on each individual.
It depends on the individual, depends on, how much they're focusing on it. So it depends on the individual.
All right. Thank you. I appreciate it.
So
Dr. O, as usual, thank you.
Oh, you're welcome, my sister. Thank God. So taking focus off of the ringing itself is helpful.
Correct. So it's about, neutralizing that negative reaction that you have to the tinnitus. How we deal with tinnitus. So how I am talking about tinnitus here is called tinnitus retraining therapy, right? So there's different avenues and different therapies that are available to dealing with tinnitus. But this is one of the therapies that we've used and have been pretty successful with at our clinic. But this is what we're talking about in regards to this session here.
Fantastic. Thank you. Dr. Kadiri says, Audiology services are among the underutilized Medicare benefits. Medicare covers audiology services, including hearing tests, hearing aids, and audiologist visits. But many eligible individuals do not access these benefits. This can be due to various factors such as lack of awareness, limited access to providers, or concerns about out-of-pocket costs. Increasing awareness and access to audiology services can help improve hearing health and quality of life for Medicare beneficiaries. You are absolutely right on the money. Thank you. And I want to venture to say, University of Maryland, where Dr. Lazarus is, is one of the best we have around here. And please, information is in the chat box if you need to access that. I heard when Attorney Oyenusi, Morenike Oyenusi said she was in your 1-year program, correct?
That's correct.
Your 1-year program. Can you tell us something about that, please, before I go on to say, I'm just curious about what the program is about.
You'd like me to kind of overview it?
Please.
So the program, again, is a 3-stage program. So for the first stage, you would come to our clinic. It's a group session. So it'd be about 10 people and maybe one significant other each. And we discuss tinnitus. The presentation that I did today, we go much more in depth. We take our time through it. We make sure we're answering questions along the way. So that's the group session. And then we do a stage 2 is then an individual consultation. So you come back and we meet you for the first time and we do testing and a consultation with one of the audiologists. And then stage 3 is we follow up with you for the year. Dr. Oyenusi was a part of all 3 stages there. And we followed up with her for that year. And maybe a couple times after, but for that year, yeah.
Fantastic. So this thing is more common than we think about. A lot of people have tinnitus, ringing in the ears, and don't know what to do about it. Attorney Oyenusi said her current goals are to spread the message, to bring the book into the hands of schools, libraries, medical offices. The more purchases people make, the more funding she will have to spread the word. And this is how you can help. Spread the word, buy the book, donate funds on website, invite her for speaking engagements, and do an Amazon review. She also says that, she posted in the chat box an article that appeared in the Hearing Health Foundation's magazine in which she was interviewed about the book. So you can click on that right now and it will take you to that interview. And also, I posted our website. I will repost it again. You can start helping me, Attorney Morenike, to post that again. So Auntie Towers said, iWatch, we are in the era of technology. She said, iWatch will alert you if you are in a noisy area and tells you the noise decibel. Can you comment on that? Because I didn't know that.
Yeah, so Apple is pretty on it when it comes to if you are even listening, if you have headphones plugged into your phone and you're turning it up above a certain level, you may get an alert that is saying that it's too loud. I don't have an Apple Watch, so I'm not sure about this in particular, but I am not surprised to hear that it probably maybe vibrates or something like that when you're in a loud environment. So yeah, the phones are getting, not the phones, but the makers of the phones are getting a little bit more. Yes, exactly. They're getting more comprehensive with that.
I have an iPhone watch. My son bought one for me, so I have to, give him a call to come show me how to know what decibels are around.
Yes.
How to
I
Yes.
was surprised the first time you did. I was like, I just jump up. I was like, what's this? And since then, if I'm in church or anywhere that is too loud, we just start vibrating and telling me it's too loud. You're in Nosi area, and this is the decibel.
Wow.
Thank
Yeah,
you
that's-
for your information. I appreciate that. And thank you, Dr. O.
Thank you, ma'am. Thank you so much for sharing that. I have to figure out how my watch can do that. Dr. Maureen Booker, kindly unmute, my darling sis. Kindly unmute and ask your question.
Yes, thank you. Interesting presentation. I must say this is one disease I've never had, but I've just heard of a friend who had it. And they said the doctors, they're not doing anything at Kaiser, that nothing is working. So I was very curious. But the Apple Watch, when we were dancing at that party, my watch showed loud environment. And I
The party
sat
we
down.
were in, the graduation party?
Yes, yes.
Ooh.
So it did show loud environment, and I came off the stage for a while and I laughed and said, "You stupid watch, what the heck, I'm partying." But I just wanted to know, is vertigo and dizziness, tinnitus and vertigo, are they related? Because most people tend to interchange them. I don't understand why, but the presentation was great. I'm really happy about it. I'm glad I listened. But
No
I know
problem.
I deal with audiology because I use my earpiece. So I know that we do have services, but they're really underused indeed. Mhm.
Yes.
Thank you.
Of course, no problem. That's an excellent question. I do want to clarify before I answer that tinnitus is not a disease. So I don't want you to leave here thinking that if you have tinnitus, if someone has tinnitus, that they are suffering with a disease. It is not a disease, but it is something that can affect your quality of life depending on how bothersome it is. And then in regards to your question, your great question in regards to, is there a relationship between tinnitus and vertigo and dizziness? So, you heard Dr. Oyenusi talk about how she experienced vertigo and dizziness, and then she experienced, the ringing. And as she explained, it's more than just a ringing, but this orchestra of sounds. There is some pathologies that can happen where there's an infection that happens in the ear, and this can cause a sudden hearing loss. So you feel like you cannot hear from that ear anymore, or you feel like your hearing has decreased in that ear. And then in conjunction to that, you may have some vertigo or some spinning. So there can be a relationship between the two. There are pathologies and some things that can happen that can result in this vertigo and this ringing at the same time. But that is a case by case, and something that we would have to talk to you or whoever is experiencing that to see if that's a likely cause of some pathology that's happening that's causing both at once. So there can be a relationship, but it's one of those things where we'd have to see the full testing and results to know if that's the case.
Thank you. The
You're welcome.
ENT surgeon says you shouldn't put anything bigger than your elbow in your ears. So that's exactly what you could put in your ears.
Okay, I'm trying to picture that. Thank you, Dr. Booker. I love that. Thank you.
Maybe he meant anything smaller than your elbow. Yes.
Nothing smaller than your elbow.
Yes.
Sorry, yeah,
Yes.
that's it. Mhm.
Thank you. Auntie Tower, kindly unmute. Thank you, ma'am.
Welcome. There was a time that my left ear was just, it's like boom, 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 boom all the time. And this went on for like 3 months. I did all the tests. They said all the tests were okay, no problem. Only to find out that it was my blood pressure. Because there's a synchrony between my carotid artery pulsing as well as this boom, boom, boom in my ear. Even if I go to sleep, I was so worried. And once they found that it was my blood pressure and they regulate everything, that was the end of it. I've never heard of it again. So can your vital sign affect your hearing or ringing or?
Yeah, that's an excellent question and an excellent observation. So yes, you can have what we call pulsatile tinnitus. So what that means is your tinnitus is synchronous with the pulse of your heart rate. So that may be something that can be medically managed if they can understand where exactly this is coming from. So yes, that can definitely happen. That's an excellent point.
Wow, thank you.
You're
Thank you.
welcome.
Sure.
So Dr. Alu says, thanks a lot, Dr. Lachelle Lazarus, for this invaluable insight. Dr. V echoed that. Thank you. Thank you. And Dr. Kadri says, turning 65. Are you turning 65? Make sure to check your Medicare eligibility. She is really reminding us about this Medicare eligibility and, people like us, right? Okay, you've worked hard to get to this milestone, and Medicare is here to help you access the healthcare you need. Don't miss out on this important benefit. Check your eligibility today and take control of your audiology health. Oh my gosh. Dr. Lazarus, did you put him up to this?
I did not.
Dr. Veronica says, thanks a million, Attorney Morenike, Euba, Oyenusi. Great job. So thank you. Attorney Oyenusi, you have your hand raised, so I'm happy. If you would add this question that you asked about the recent research at the
Right.
same time, that'd be great. Thank
I was
you.
going to ask that question actually. So, Dr. Lazarus, I understand that some recent research has been done to the fact that there are clues that can help us to figure out the cause of tinnitus, and that could potentially help reverse some hearing loss issues or some deafness issues. I think the study was in the New Scientist, but I wasn't able to access it because you need to have a paid subscription. I was just wondering whether you know anything about that study.
I would need to look more into that to get the details of that. But when we're thinking about, reversing the types of deafness, so hearing loss is from the hair cells in our hearing organ, right? So if we can, it's not like our hair on our head, where if we pick our hair, it comes back, right? Hair cells in our hearing organ, unfortunately, do not regenerate. So there has been research on, can we regenerate these hair cells? And it's hard to do this research because who is willing to give up their hearing, to see if we can bring it back. So it's kind of at a standstill of where we are in reversing deafness, but I don't want to fall short and say anything that's against that research, because I do want to read up on that and see, but I don't have the details of that research.
Thank you. Thank you. So Brother Damien says, thank you for this useful information. I think he's in the Caribbean. Haman also thanks you. And Dr. Imodis, Mr. Imodis said, does tinnitus have any connection to migraine headaches? So
tinnitus does not cause migraine, but because of migraine, the tinnitus may feel like it's worse. And in the tinnitus feeling like it's worse, it may make your migraine worse. So you can kind of get into this loop, but what you can try to remember, if there's some bullet points that you want to remember from this talk, is that tinnitus is not a threat to your health. Tinnitus is not a threat to your hearing. Tinnitus is not an effect to your mental health at all. So when you're having these ailments and you are wondering, the tinnitus is very bothersome, what we typically see is that it's the ailment that is causing your body to be in a state of stress and worry and irritability, and that can cause the tinnitus to be much more bothersome.
Thank you.
You're welcome.
So another question says, thanks for the presentation. Do you think wearing earphones regularly can cause tinnitus?
If they're overworn, right? So if you are wearing earplugs when they are not necessary, so if you are wearing them outside of loud environments, then what you're doing is you are essentially, so if you recall from my presentation, I talked about a conductive hearing loss, right? So let's say your ears are plugged up for long enough, you're going to start hearing this ringing because you are creating a contrast between the loudness of the environment and the sound of your tinnitus, right? So what you're doing is if you're wearing your hearing protection for an extended amount of time it's not necessary, you're in a quiet environment, you are increasing the contrast between the silence in the room and the loudness of your tinnitus. So if you are doing that at an excessive amount of time, then you may, in fact, be causing the tinnitus to be worse because you're not allowing that natural auditory input to come into your system.
Fantastic. Damien, kindly unmute. Dr. Damien, if I'm not mistaken, kindly unmute. Unmute and ask your question. Okay, while you try.
Good day.
Good evening. Welcome.
Dr. O, how are all the others?
It's been a while.
It's been a while.
Yes.
Thank you for this session. I'm from Dominica, a little island in the Caribbean. We call it
Yes.
Beach Island World.
Awesome. One of my
Beautiful.
best friends is Dominican, so happy to have you.
You need to make the contact so I can tell them hello for you.
Yes.
But I'm a dentist by profession, and we use instruments which, I mean, I never realized until I listened to you, because you have this drill and that's in your ears how many times for the day. I'm just wondering if it's something to be concerned about, because when I walk about and I see guys, like the guys walking on the road drilling with nothing in their ears, I always caution them. So, but now I'm thinking of whether there's any impact. And Dr. O, let me just thank you publicly for initiating these sessions and the topics over the years, you and your team. So just want to wish you all the best.
Thank you so much.
Thank
I
you.
appreciate you, brother. God bless you.
Yep. That's an excellent observation. With those tools, with dentistry tools, that's a very high-pitched sound for an extended period of time. So although it may not necessarily be a cause for the tinnitus, you just want to be aware of cause for your hearing ability, right? You don't want to exacerbate any kind of like high frequency or high pitched hearing loss. So if you don't want to have, complete earplugs that block off everything, you can look into getting musician earplugs, and that's for anyone here. What musician earplugs do is they don't stop up your ear completely, but what they do is they add a filter into the ear mold so that some natural sound can still come through. It kind of just dampens the sound as opposed to completely close off the sound. So that's something that you may want to consider using like a musician earplugs, because of course you still need to hear, right? You need to hear if a patient says, ow. So having something that just kind of dampens the sound as opposed to blocking it, I would look into musician earplugs.
Thank you very much.
You're welcome.
Fantastic. So that's what the drummers put on. I see them with their plugs.
Well, so for musicians, what they're typically using is in-ear monitors. So they're putting in the earplugs and they're talking to each other to kind of keep everyone on track and things like that. So you kind of have to be careful about musicians too. But drummers should be wearing hearing protection, yes.
Yes. So Sister Anna says she used to have ear infections as a child and then vertigo. Since she has stopped using Q-tips and learning through her own experience of how to properly take care of her ears, she no longer have ear infections or vertigo. So can you comment on that? You know, using Q-tips and stuff like that can actually, she said, cause frequent ear infections and vertigo.
So, regarding Q-tip use, for ear infections, it's not common. The only way I've seen the ear infections happen through Q-tip use, or sometimes people bravely use bobby pins to scratch their ear. I've seen it many times. And when you're using bobby pins, that's more sharp. So you're cutting your ear and then you're creating an ear infection in there. So that can happen. When we're talking about vertigo, typically, so I'm not saying that this is not true, but for your particular case, but typically, right, vertigo is from the inner ear. We can't access our balance system from the outer ear. It is more internal. So using Q-tips should not cause vertigo, but if there's some kind of unique pathology that if you have pressure in your ears, you may get dizziness, things like that. It's one of those things that's very specific. So I wouldn't want people to think, even though we are straying away from Q-tips, right? We are committing to no Q-tips after tonight or this morning, depending on where you are. Using Q-tips won't cause vertigo and ear infections.
Thank you. Q-tips, though, would push earwax deep into the ears and will cause hearing loss. You won't hear well. We clean it out and they say, oh my gosh, I can hear again. So Q-tips are not recommended. We don't recommend them. So what about over-the-counter earrings? Are they recommended? I think
yes.
The Brox. Okay, great. The Brox, Ceruminex is another. I don't know. I don't remember any others. I know there are others over the counter. There's a question here. Herman, you in Britain, you asking inflammatory questions. Did you see what he asked? He said, just a question from across the pond. Would a certain president of the United States suffer with his hearing due to that infamous incident at the weekend? And can the present president be suffering from hearing issues that has caused some interesting answers or responses to situations, questions, etc.? Haman, I'll tell you, like the questions have been answered over and over tonight. It's individual. Our presidents have to be evaluated individually. And we pray that the unfortunate incident over the weekend will not cause hearing loss or any hearing issues. We can only pray about that and hope that. So, Sister Maka says, thank you so much, Dr. Lazarus and Attorney Oyenusi, for such excellent presentations. Much appreciated. And Herman, hope things are getting better in the Dominica due to the recent hurricane. He's on the political bench tonight. The weather and political, he says, take care and stay blessed. So Susanna says, yes, earwax was pushed into her own ears using Q-tips, which then caused her to lose hearing. And then with elevated ear pressure environments, she used to get vertigo from that. I can see how that can happen. What do you think, Dr. Lazarus? She said earwax was pushed into her own ears using Q-tips when she used to do that, which then caused her to lose hearing. And then with elevated ear pressure environments, she would get vertigo.
Yeah, that's similar to, what I mentioned there with the wax That's a conductive loss when it's compacted in your ear. And then with the pressure changes, for some individuals that can cause vertigo there.
Thank you. So, thank you so much for that. Haman, we appreciate you. He says, God bless America, after all. Thank you. We appreciate that. And Sister Nana says, thanks for this great and informative session. And Attorney Oyenusi is saying that everyone, you can feel free to call her. I reposted her information. Ola says, thank you for the presentation. And Dr. Damian gave his email address. Did you see that? Dr. Lazarus, that's for you. Kindly link.
Yes, I wrote it down. Thank you.
Okay. And thank you so much. Dr. Lazarus says you're all so welcome. And Zobam from Nigeria, I believe, right? Yes, the presentation is awesome. More of this. Thanks for the organizers and presenters. Dr. Eunusi, thanks for sharing your story and links to your books library. Thank you. We appreciate you all. And I don't know where Dr. Veronica is. She was going to post something in the chat box for our people running for office in California. But this is very, Dr. V, you are still on. So if you post that, and meanwhile, Dr. Lazarus, I would ask please that you please leave us with your parting words, your parting advice, what you would advise us to take home.
Yeah, the fact that you're here and you are attentive and listening and learning, that's the first step, right, in good health. I always say, like, when people are dealing with tinnitus, I would never say, stop exercising. I would never say, stop eating well, things like that. Holistic health is very important when we're talking about tinnitus, right? And that includes stress management. That includes, being mentally healthy. So when we're thinking about tinnitus, we want to think about how are we as a whole, right? How are we in our healthiest ways? We want to incorporate that and we want to live that out fully, physically, spiritually, mentally. We want to make sure that we are on the right path. So that's what I would leave you all with. I thank you again for your attention. Morenike, I can't thank you enough for extending this invite. This has been an awesome, attentive, very intelligent group of individuals. And I love to see my people and to, pour into you as you pour into me. So I'm so grateful for this time, truly.
Thank you so much. We appreciate you beyond words. God bless you, and may the Lord
God bless you too.
As you've poured into us, the Lord will replenish you. Thank you.
Amen. I received that. Thank you.
You.
Thank you.